Doctors are warning parents tonight about an emerging trend they're seeing in their offices. Children and teens who take healthy or clean eating to the extreme, fueled by what they're seeing on social media. And as Bianca Castro reports, doctors say the trend could lead to physical or mental illness.
Healthy eating never looked so good as it might on Instagram or Facebook. But psychologists at Children's Health in Dallas say more young people are taking it to the extreme, leading to a condition that's just one step away from an eating disorder. It's called orthorexia, and it's when someone becomes obsessed with clean eating.
People will narrow the foods that they'll eat down to a small group of things based on these ideas of what, in their minds, what is clean or unclean, or what is healthy or unhealthy. So
Dr. Andrew McCarahan says the term orthorexia was first coined about 20 years ago. It's not a clinical diagnosis, but he says anyone who suffers from it can fall down a slippery slope, restricting their diet so much that their, quote, healthy choices become bad for the body.
Your body wants a balance. It doesn't just want kale and broccoli, and it doesn't just need kale and broccoli. It needs a balance.
But he says it can also be dangerous for anyone with a family history of eating disorders. He warns parents that if your child begins to withdraw from activities to avoid food or always wants to eat by him or herself, your child's obsession may have manifested into a mental health disorder.
If you plan on stocking up on hand sanitizer this flu season, you may want to think again. Researchers in Japan tested the effectiveness of ethanol-based sanitizer on killing the influenza A virus. They found it took the sanitizer 4 minutes to deactivate the virus in wet mucus. With dry mucus, it only took 30 seconds to deactivate it. That's the same time it took antiseptic soap and water to work, regardless of whether the mucus was wet or dry.